Hi everyone, I'm filming this from a small town north of Dallas. Filming it for the obvious reason that being 8,000 kilometers away, I couldn't make it to class to speak to you in person. My case was that of a middle-aged and vegetarian homosexual man, recently tested positive for HIV. Though it's still asymptomatic, HIV is a war of attrition, and HIV replicates much faster than our CD4 lymphocytes replicate, creating a state of AIDS, which, when left alone, will allow for manifold infections to set in and create serious disease. My task was to formulate a treatment protocol that would raise and manage raised CD4 count without the intervention of antiretroviral drugs. While this is no meagre undertaking, I think practitioners can psych themselves out with the magnitude of the disease that they're trying to treat naturally. As a whole, cancer, HIV, AIDS, and other big-name diseases seem impossible to treat naturally. But we've all heard the ancient Chinese proverb that the journey of 1,000 miles begins with a single step. And if this is the attitude that I took in my approach to treating HIV naturally, one angle and one nutrient at a time. I started the research process by filling in the gaps in my own knowledge, and I quickly found that the gaps were quite large. So I began with the pathology of HIV, which is extensively documented. A clue lay in the cellular studies, where HIV-infected cells showed sky-high oxidation markers and rock-bottom glutathione levels when compared to uninfected cells. T-4 lymphocytes will utilize intracellular glutathione to reduce the viral reverse transcriptase enzymes. This approach is successful until the T4 cell ingests one too many virus capsules and is out of glutathione, which needs to be recycled in the cell before it can be used again. You see, HIV is chronic inflammation, and we know that chronic inflammation causes chronic oxidation, requiring antioxidants. So I began seeking research that had successfully treated HIV with antioxidant therapy. I found an interview with Dr. Lester Packer, in which he discussed the benefits of alpha-lipoic acid as a treatment for HIV. He touched on the need for sulfur supplementation as well to assist in the heightened need for glutathione. Based on this interview, I crafted my clinical question. In HIV-positive adults, how will alpha-lipoic acid and associated antioxidants, in conjunction with sulfur-rich foods, support the immune system and build CD4 count, compared to retroviral drug therapies? Much of the research conducted on antioxidant therapy for HIV took place in the 90s, and most of that studied research was conducted in Uganda. The subject criteria ranged from pregnant to breastfeeding to sexually transmitted to injected. However, all of these papers were difficult to obtain, so the majority of my information was gained from literature reviews and meta-analyses. And many papers, it seemed, hailed N-acetylcysteine as the ultimate antioxidant, and it did yield impressive results, mostly because the cysteine in N-acetylcysteine provided the sulfur needed for the synthesis of glutathione. However, the work of Dr. Lester Packer presented alpha-lipoic acid as an alternate and far superior antioxidant for the treatment of this virus, for a few very good reasons. It actively recycles glutathione and vitamin C, protects vitamin E, as well as quenches free radicals in its own capacity. Further, because alpha-lipoic acid is both lipid and water-soluble, it adds further protection to the lipid bilayer of the cell. By protecting the cell and protecting vitamin E, which is the primary antioxidant for the cell's membrane, the external structural defense of the cell is fortified. Packer stated that alpha-lipoic's presence in the cell is natural for all of these purposes, but not in the amounts needed to defend against the chronic infection of HIV. He then theorized that by supplementing alpha-lipoic acid in higher doses, the antioxidant activity could be raised in proportion to the viral load. In trials, the supplementation of alpha-lipoic acid was successful, but the results were only short-term because the trials lasted but a few months, with low doses and without great percentile significance because there were only a handful of test subjects. Furthermore, some studies featured HIV-positive subjects and did test alpha-lipoic acid as a therapy, but the subjects were infected from the use of intravenous drugs and were still injecting drugs throughout the studies. Needless to say, those studies showed no difference, mostly because of the increased oxidative load on their liver from both drugs and the virus circling through their system. The other problem with the African studies is that the dietary status of the subjects would have been incomplete, so nutrient effect would have been diminished further. I also found plenty of studies combining nutrients, such as B complex, zinc and folate, or zinc and selenium, or N-acetylcysteine and selenium. However, the studies were, once again, short-term, with small subject groups, and with low doses. Furthermore, the studies shortchange in only one variable, such as a CD4 count or weight gain or viral load, which is understandable because a test or a trial becomes far more complicated when there are too many factors to try and monitor the change in. However, the other side of that coin is that the body is a complex system and operates progressively. So measuring CD4 count after only a couple of weeks and expecting a huge change is unrealistic because there are going to be many other processes leading up to the benefit and the boom of CD4 count in the body. Further, levels of oxidation could be measured as the initial change, or CD4 counts in various other parts of the body, such as the intestines, because it's been shown that intestinal CD4 count is one of the first areas where the CD4 lymphocytes are wiped out during the initial stages of infection. Results should be sought appropriate to the chronology of physiological processes, and with an attitude of holism, understanding that nutrients will work in synergy together. In my opinion, a trial that supplemented the nutrients required in combination for a long period of time would yield far more realistic results than a short-term trial with isolated nutrients, especially if the diet is insufficient, because the body will prioritize nutrients, and the body's priorities for where those nutrients need to be utilized may be different than the priority of the researcher and what they want to measure. Nevertheless, the nutrients all elicited some positive effect, and at low doses too. And the best part, no adverse reactions were recorded or any adverse interactions between the variety of nutrients. Finally, pre- and probiotics have displayed a dramatic effect on intestinal humoral immunity, remarkably raising CD4 counts in small and large intestines. Since HIV drives inflammation while suppressing immunity, and all the physiological processes associated with immunity, such as cell repair, in HIV, colon cancer becomes a serious concern. The prebiotics administered were pure fructose oligosaccharides, but I think even better results could be derived using fermented brassica vegetables, given their sulfur content, for glutathione and the short-chain fatty acids they would provide when given concurrently with a broad-spectrum and densely populated probiotic. In the end, I found so many nutrients that were beneficial and would work synergistically together that I just decided to prescribe them all. Zinc, selenium, vitamin E and vitamin C, vitamin B complex, alpha-lipoic acid, as well as acetylcysteine, plus pro and probiotics. Since my client leads a calm and considered lifestyle, and he is eager to buy local, fresh, organic produce, he likes riding his bicycle, and is in a stable, supportive relationship, the extra factors in his life are not adding to the stress. Furthermore, he has sought out nutritional advice and understands how much work and support he will need therapeutically, so I expect his compliance to be quite high. Food-wise, the main concern is providing enough energy. Research shows that the resting energy requirements of an HIV-positive person is nearly double that of an unaffected, healthy person. Once the body resorts to burning muscle for energy, the patient develops wasting syndrome, creating the frighteningly thin physique that heralds the beginning of AIDS. To avoid this, eating is important. The supplementation of alpha-lipoic acid and N-acetylcysteine are shown to stimulate appetite in patients who are HIV positive and are already showing signs of muscle wasting. Coupling appetite with protein-rich foods plus digestive enzymes to allow full assimilation of those nutrients for healing and energy production will allow for better absorption and assimilation of all of these nutrients. However, my client is vegetarian, and I was concerned that he would not get enough protein without any meat in his diet. Eggs are a complete protein, as we know, but in order for my client to meet his protein requirements, he would be needing to eat many, many eggs, which is not realistic. Studies testing whey protein, however, show excellent protein assimilation and utilization of the nutrient, and at low doses as well, which makes it much easier for me as a practitioner to supplement appropriate doses for what we need. Whey protein is a healthy source of cysteine as well, which further builds the foundation for glutathione synthesis. My client enjoys juicing, so he can add whey protein and fortify each meal to provide the increased need of the molecular building blocks needed to keep him healthy. I also suggested that once settled into his routine and once we start to see results, that my client start sharing his story and encouraging others in the HIV-infected gay community. I think this will help him to keep motivated personally, as well as empower him and give him a sense of purpose throughout his disease, which supports a healthy mental attitude, which in turn supports his overall well-being. In conclusion, the treatment of HIV naturally is, of course, a huge undertaking and deeply involved, and is going to require thoughtful and considered management from all angles. More research is needed to quantify dosing of nutrients and studies creating holistic treatments from diet to supplements to lifestyle, which will greatly assist practitioners and clients alike in their search for natural therapies in HIV. Thank you for listening, and I'll see you all next semester.